1. Which of the following is the most effective method to ensure consistent compliance with order processing protocols among new pharmacy technicians? A. Encouraging self-directed learning through SOP handbooks. B. Conducting unstructured peer reviews. C. Implementing regular scenario-based simulation training. D. Relying solely on performance appraisals. 2. A pharmacy technician discovers a discrepancy between the received inventory and the purchase order. What is the most appropriate initial step? A. Discard the excess inventory. B. Notify the pharmacist and document the discrepancy. C. Store the inventory and wait for clarification. D. Return the entire shipment to the vendor. 3. Which quality assurance method best aligns with adult learning principles in a pharmacy setting? A. Didactic lectures on error prevention. B. Peer observation with real-time feedback. C. Periodic ungraded tests. D. Role play without debriefing. 4. When instructing new hires in inventory management, which curriculum development approach is most suitable? A. Rote memorization of drug classifications. B. Interactive case studies emphasizing common stock errors. C. Reading textbook chapters on supply chain. D. Watching inventory software tutorials alone. 5. Which action best reflects regulatory compliance in controlled substance inventory? A. Verifying quantities monthly. B. Conducting a biennial inventory count. C. Performing daily verbal confirmations. D. Relying on vendor records alone. 6. A pharmacy technician consistently enters incorrect lot numbers during inventory updates. What mentoring strategy would best support their improvement? A. Assigning punitive documentation exercises. B. Mandating extra hours without pay. C. Scheduling shadowing with a high-performing peer. D. Reassigning the technician to unrelated duties. 7. What is the most effective way to evaluate a technician's competency in order verification? A. Oral quiz on drug names. B. Random inspection of processed orders. C. Counting number of orders completed. D. Assigning additional orders under time constraints. 8. Which federal agency is primarily responsible for regulating pharmacy inventory of controlled substances? A. FDA. B. CMS. C. DEA. D. OSHA. 9. A technician is unsure how to process a backordered medication. What communication method ensures clarity and professional development? A. Sending a group email. B. Waiting for the supervisor to notice the issue. C. Engaging in a direct discussion with the pharmacist. D. Posting a question on a social media forum. 10. How should a pharmacy handle expired medications in inventory? A. Dispose of them in the general waste. B. Store them in a separate, clearly labeled area for return or disposal. C. Repackage and resell them. D. Donate them to local shelters. 11. Which of the following best supports a culture of safety and quality in order processing? A. Encouraging speed over accuracy. B. Punishing all dispensing errors equally. C. Establishing a non-punitive reporting system. D. Limiting feedback to annual evaluations. 12. What is the best method to track temperature-sensitive medication inventory? A. Manual logs updated weekly. B. Monthly review of storage conditions. C. Real-time electronic monitoring systems. D. Trusting vendor compliance reports. 13. During an inventory audit, what tool provides the highest level of data accuracy? A. Handwritten spreadsheets. B. Verbal confirmations. C. Barcode scanning systems. D. Manual stock cards. 14. Which aspect is most critical when teaching technicians about hazardous drug handling? A. Memorizing OSHA standards. B. Reviewing anecdotal safety stories. C. Demonstrating proper PPE use and disposal. D. Assigning textbook chapters. 15. Which inventory management concept emphasizes minimizing overstock and understock conditions? A. FIFO. B. Reconciliation. C. Par-level inventory control. D. Rotation scheduling. 16. A mentoring pharmacy technician uses active listening and open-ended questions to assist a peer. This approach best exemplifies A. Directive supervision. B. Adult learning facilitation. C. Authoritative mentoring. D. Memorization strategy. 17. What strategy most effectively prevents medication picking errors? A. Alphabetical organization of drugs. B. Limiting technician access. C. Using tallman lettering and barcode scanning. D. Speed-based performance bonuses. 18. Which document should be reviewed to confirm proper inventory receipt? A. Medication guide. B. Drug formulary. C. Packing slip and purchase order. D. Product insert. 19. Which federal requirement governs the maintenance of controlled substance records? A. They must be kept for 12 months. B. They must be stored separately and be readily retrievable for 2 years. C. Records must be electronic only. D. They are optional for Schedule 5 drugs. 20. A newly hired technician is overwhelmed with inventory procedures. What instructional method best aligns with adult learning principles? A. Extended lectures on policy. B. Step-by-step demonstration and guided practice. C. Assigning independent study with a quiz. D. Repeating instructions without feedback. 21. Which is the most accurate way to assess performance in quality assurance practices? A. Collecting customer satisfaction forms. B. Reviewing error reports and trending data. C. Asking technicians if they feel confident. D. Comparing against historical sales data. 22. A pharmacy technician is being trained on investigational drug orders. What is the first priority in instruction? A. Legal documentation and protocol adherence. B. Speed of processing. C. Vendor relationship management. D. Cost-saving measures. 23. A communication log used during shift changes primarily serves to A. Replace verbal reports. B. Increase technician accountability and continuity of care. C. Reduce the number of staff meetings. D. Document daily cleaning tasks. 24. When building a training module on perpetual inventory systems, what should be the foundational objective? A. Explain financial implications. B. Demonstrate real-time adjustment processes. C. Provide history of inventory tracking. D. Describe various vendors. 25. Which technique is best when evaluating technician accuracy in order processing? A. Simulated prescription processing with checklist scoring. B. Asking the technician to self-report errors. C. Observing customer interaction only. D. Reviewing time logs. 26. When implementing a new inventory software system, which training method is most effective for adult learners? A. Detailed manuals without practice sessions. B. Interactive simulations with real-time feedback. C. Recorded webinars with no follow-up. D. Memorization quizzes. 27. What action best supports regulatory compliance during medication order fulfillment? A. Prioritizing speed to avoid patient wait times. B. Completing all documentation after orders are filled. C. Verifying DA numbers for controlled substances. D. Relying on memory for prescription laws. 28. What is the primary purpose of quality assurance checks in order processing? A. Increase technician workload. B. Satisfy vendor requirements. C. Reduce medication errors and ensure patient safety. D. Minimize software downtime. 29. Which practice best aligns with a just culture approach to handling dispensing errors? A. Terminating technicians after one mistake. B. Ignoring errors unless there is a complaint. C. Focusing on system improvements rather than individual blame. D. Publishing names of technicians who make errors. 30. A technician must learn proper handling of cytotoxic agents. What educational approach is most appropriate? A. Reading OSHA guidelines independently. B. Watching safety videos only. C. Participating in hands-on PP and spill kit training. D. Reviewing drug labels online. 31. Which pharmacy inventory system allows for real-time tracking and minimal manual intervention? A. Periodic inventory system. B. Manual logging system. C. Perpetual inventory system. D. Vendor auto-reorder system. 32. How can a preceptor ensure long-term retention of order entry procedures among trainees? A. Assigning them to work unsupervised. B. Providing hands-on tasks with reflective feedback sessions. C. Offering multiple choice tests only. D. Showing slideshows during orientation. 33. A technician notices expired stock still available on the shelf. What is the most compliant action? A. Ignore it until the monthly audit. B. Use the medications to minimize waste. C. Remove and quarantine the items for disposal. D. Notify patients of the expiration date. 34. A technician mislabels a drug during repackaging. Which quality assurance practice would have prevented this? A. Focusing only on controlled substances. B. Skipping lot number verification. C. Implementing double-check procedures. D. Trusting vendor labeling without inspection. 35. How often should pharmacies perform inventory counts of Schedule II drugs according to DA regulations? A. Annually. B. Every 2 years. C. Monthly. D. Quarterly. 36. A technician incorrectly processes a refrigerated medication as room temperature. What follow-up strategy promotes learning and safety? A. Ignoring the issue unless a complaint arises. B. Disciplinary write-up with no feedback. C. Constructive feedback and review of temperature handling procedures. D. Letting a pharmacist handle future orders. 37. Which communication strategy fosters mentoring during inventory management training? A. Dominating discussions with instructions. B. Encouraging questions and using teach-back methods. C. Avoiding feedback to maintain confidence. D. Correcting every error without explanation. 38. A pharmacy is transitioning to unit dose packaging. What quality assurance step is essential? A. Repackaging only the most prescribed drugs. B. Documenting NDC, lot number, and expiration on each unit. C. Mixing drugs of similar appearance. D. Limiting repackaging to peak hours. 39. Which scenario reflects a violation of inventory regulatory compliance? A. Documenting partial doses dispensed. B. Logging receipts of Schedule II drugs in a separate record. C. Storing Schedule III drugs with general stock. D. Failing to reconcile received controlled substances with the invoice. 40. Which training strategy best enhances accuracy in automated dispensing machine operations? A. Reading the machine's user manual only. B. Observing a pharmacist fill the machine once. C. Participating in guided simulations and troubleshooting exercises. D. Skipping training due to system intuitiveness. 41. In the context of inventory audits, what is cycle counting? A. Full inventory done once a year. B. Weekly ordering based on par levels. C. Continuous counting of subsets of inventory. D. Replacing all expired drugs monthly. 42. Which method supports accurate receiving of pharmaceutical shipments? A. Verifying item quantity only. B. Reviewing purchase orders against packing slips and invoices. C. Trusting vendors without documentation. D. Skipping review if the shipment is urgent. 43. What is the most important mentoring technique when addressing recurring technician errors in order processing? A. Public correction. B. Written reprimand without explanation. C. One-on-one coaching with targeted skill development. D. Assigning different roles. 44. A pharmacy receives medication labeled in error. What is the first compliance step? A. Report the error to FDA's MedWatch and segregate the product. B. Send the product to a different pharmacy. C. Dispense the product cautiously. D. Return it to the shelf for future review. 45. A pharmacy uses a batch compounding log. What information is essential to record for regulatory compliance? A. Pharmacy technician name only. B. Only the expiration date. C. Lot number, expiration, quantity, and preparer signature. D. Product cost. 46. What is the benefit of applying adult learning theory when training pharmacy staff? A. Reduces need for ongoing supervision. B. Ensures better compliance through engagement and relevance. C. Encourages memorization of policies. D. Emphasizes lecture-based delivery. 47. Which of the following best demonstrates technician responsibility during quality assurance documentation? A. Guessing lot numbers when unclear. B. Backdating expired inventory. C. Reporting actual data and discrepancies accurately. D. Delaying entries until end of shift. 48. What should be emphasized in training to ensure compliance with USP less than 800? A. Label reading skills. B. Personal protective equipment PP usage, containment strategies, and documentation. C. Medication color coding. D. Sales strategies for hazardous drugs. 49. Which is a proper technique for managing inventory returns? A. Disposing of unopened medication. B. Returning expired drugs through reverse distribution channels. C. Giving returns to staff. D. Ignoring product recall instructions. 50. What is the recommended frequency for cleaning automated counting machines to ensure accuracy and safety? A. Once per year. B. Monthly, regardless of use. C. After each use or per manufacturer guidelines. D. Only when switching medications. 51. Which inventory practice minimizes waste due to expiration? A. Storing medications alphabetically. B. Dispensing newly received stock first. C. Following the first in, first out FIFO method. D. Ordering bulk medications quarterly. 52. What is the primary role of DA Form 222 in inventory management? A. Reporting theft of controlled substances. B. Returning expired over-the-counter medications. C. Ordering Schedule 1 and 2 controlled substances. D. Tracking the cost of inventory. 53. A technician miscounts tablets during repackaging. What quality assurance protocol should follow? A. Ignore the error if it's close. B. Recount and document under double-check supervision. C. Repackage and seal immediately. D. Add extras to compensate. 54. A new pharmacy technician has difficulty interpreting inventory printouts. What instructional technique best aligns with adult learning principles? A. Repeating printout definitions. B. Assigning memorization exercises. C. Hands-on walkthrough with examples and guided correction. D. Allowing trial and error for practice. 55. Which report helps pharmacy managers identify slow-moving inventory? A. DA Form 106. B. Inventory Turnover Ratio Report. C. Recall Notification Report. D. Receiving Log. 56. What does a perpetual inventory system most accurately track? A. Monthly total costs. B. Average prescription volume. C. Real-time stock levels. D. Vendor reliability. 57. What process ensures traceability and safety during medication recalls? A. Disposing of all related products. B. Documenting only lot numbers. C. Using lot numbers and expiration dates to identify affected stock. D. Notifying patients directly without pharmacy review. 58. How often must pharmacies review and revise standard operating procedures (SOPs) for order processing? A. Only when a new technician is hired. B. At least annually or when major changes occur. C. Every 5 years. D. SOPs never need revision once created. 59. A pharmacy's inventory shows consistent overstocking. What mentoring approach best helps technicians avoid future issues? A. Punitive deduction from hours. B. Blaming vendor errors. C. Collaborative review of ordering procedures and par levels. D. Ignoring unless budget is exceeded. 60. What is the most critical factor when documenting a medication error in quality assurance systems? A. Technician's disciplinary history. B. Emotional impact on staff. C. Objective, factual details of the incident. D. Patient satisfaction survey. 61. A technician logs a controlled substance into inventory but doesn't record the lot number. What type of compliance risk does this pose? A. Financial discrepancy only. B. No risk if quantity is correct. C. Violation of DEA record-keeping regulations. D. Violation of OSHA policies. 62. What best ensures consistent medication storage conditions? A. Vendor guidelines only. B. Staff experience. C. Daily temperature and humidity monitoring. D. Patient feedback. 63. What tool is most useful for evaluating technician efficiency in order processing? A. Customer service survey. B. Drug monograph review. C. Order error rate and fill time reports. D. Break logs. 64. A mentor is preparing a peer to lead quality assurance rounds. What teaching technique promotes confidence and knowledge retention? A. Lecture-only session. B. Shadowing followed by independent facilitation. C. Printed checklist review. D. Email instructions. 65. Which regulatory body oversees drug product recalls? A. DEA. B. FDA. C. CMS. D. OSHA. 66. A pharmacy receives a shipment missing 2 items. What is the first step to take? A. Refuse the entire shipment. B. Accept and dispense what's available. C. Notify the supplier and document the missing items. D. Adjust inventory to expected amount. 67. In adult learning theory, which factor is most influential in motivating pharmacy staff? A. Length of training. B. Authority of the trainer. C. Relevance of content to daily tasks. D. Formality of materials. 68. A technician repeatedly overorders certain drugs. What follow-up best promotes learning and compliance? A. Publicly announcing the error. B. Providing a warning notice. C. One-on-one coaching session with ordering examples. D. Assigning unrelated duties. 69. How does barcode scanning during dispensing improve quality assurance? A. Speeds up workflow only. B. Eliminates the need for technician training. C. Verifies correct medication and reduces human error. D. Replaces pharmacist verification. 70. Which step is critical before returning medications to stock after a patient refuses pickup? A. Repackage with a new label. B. Check for proper storage and expiration date. C. Remove from system inventory. D. Place directly into active bins. 71. A technician asks for clarification during hazardous drug training. What instructional response best models supportive communication? A. Figure it out after training. B. That's not important right now. C. Great question, let's address it together now. D. Ask your supervisor later. 72. What is the most appropriate use of medication usage reports? A. To compare technician speed. B. To assess drug expiration rates only. C. To monitor ordering patterns and optimize inventory. D. To justify employee evaluations. 73. Which of the following is a risk of inaccurate receiving procedures? A. Higher pharmacist salaries. B. Disruption in insurance billing. C. Stock discrepancies and billing errors. D. Improved customer service. 74. How can a technician most effectively mentor a peer in handling temperature-sensitive medications? A. Print out temperature charts. B. Demonstrate procedures and allow supervised practice. C. Email SOPs only. D. Let the peer figure it out during a shift. 75. A quality assurance review reveals frequent repackaging errors. What is the best next step? A. Replace the technician. B. Increase order volumes to distract from errors. C. Review protocols and retrain involved staff. D. Blame the labeling software. 76. What is the most appropriate action if a technician notices inventory theft? A. Ignore to avoid conflict. B. Report through the designated internal channel immediately. C. Ask coworkers privately. D. Post on social media anonymously. 77. What tool is best for analyzing trends in technician performance over time? A. Daily attendance sheet. B. Monthly QA audit log. C. Number of prescriptions per patient. D. Vendor return forms. 78. How does clear role definition support order processing quality? A. Reduces responsibility confusion and improves accountability. B. Increases management workload. C. Minimizes need for training. D. Encourages informal practices. 79. A technician complains about duplicate training. How can an educator apply adult learning principles to resolve the issue? A. Ignore the concern. B. Emphasize compliance regardless of value. C. Integrate new training with practical application and feedback. D. Reassign to another technician. 80. Which quality assurance metric best identifies safety gaps? A. Monthly budget. B. Staff preferences. C. Error trend reports over time. D. Break schedules. 81. What is the first step when receiving a product subject to a national recall? A. Dispense immediately. B. Document lot numbers and quarantine the product. C. Ignore the recall if product looks safe. D. Wait for patient complaints. 82. A technician is reluctant to follow a new ordering protocol. What mentoring strategy is most effective? A. Direct criticism. B. Assigning easier tasks. C. Collaborative discussion to address concerns and explain rationale. D. Avoiding the issue. 83. How does cross-training impact inventory control? A. Reduces staff interest in specialization. B. Increases scheduling conflicts. C. Enhances flexibility and reduces bottlenecks. D. Delays ordering cycles. 84. Which activity is least effective in reinforcing best practices in repackaging? A. Annual training updates. B. Real-time performance feedback. C. Peer-reviewed audits. D. Ignoring labeling deviations. 85. How can a supervisor best evaluate compliance with hazardous drug handling policies? A. Observing PPE usage during compounding. B. Reviewing drug cost reports. C. Counting gloves used daily. D. Asking informal questions. 86. What method best supports consistent compliance and cycle counting? A. Assign one technician permanently. B. Count only fast-moving stock. C. Schedule counts regularly with logs and spot checks. D. Eliminate manual counts. 87. A technician scans the wrong barcode during dispensing. What process best prevents recurrence? A. Hiding the error. B. Removing all barcodes. C. Providing barcode scanning re-education and system alerts. D. Removing the technician from the workflow. 88. What is the final step in the drug recall process at a pharmacy? A. Ignoring the recall after 30 days. B. Documenting the return or destruction of the recalled product. C. Sending the product to another store. D. Removing it from the shelf only. 89. How can data visualization improve inventory training? A. Creates confusion for new staff. B. Makes numerical trends more accessible and actionable. C. Replaces hands-on training. D. Slows down learning. 90. What principle of adult learning applies when a technician corrects their own documentation error? A. Operant conditioning. B. Passive observation. C. Self-directed reflection and ownership. D. External pressure. PTCB Order Processing, Inventory, and Quality Assurance Test. The PTCB Order Processing, Inventory, and Quality Assurance Test assesses a pharmacy technician's knowledge and practical skills in managing medication orders, maintaining inventory accuracy, and ensuring quality assurance in pharmacy operations. The exam evaluates competencies such as verifying prescription information, processing medication orders accurately, implementing proper storage and disposal procedures, and adhering to safety and regulatory guidelines. Technicians are also tested on their ability to identify and report medication errors, manage supply chain processes, and support continuous improvement initiatives. Mastery of these topics ensures patient safety, regulatory compliance, and efficient pharmacy workflow, critical responsibilities in both retail and institutional pharmacy settings. Here are the top 5 beneficial uses of the sample exam. 1. Ensures medication safety and accuracy. By validating a technician's ability to process orders accurately and manage inventory, the test helps reduce medication errors, enhancing patient safety. 2. Supports regulatory compliance. The exam ensures technicians are trained in DA, FDA, and USP standards, reinforcing pharmacy adherence to legal and safety requirements. 3. Improves workflow efficiency. Technicians with certified skills in inventory control and quality assurance contribute to smoother operations, reducing stockouts, expired medications, and dispensing delays. 4. Enhances career advancement. Certification demonstrates advanced competency in critical pharmacy functions, opening doors for promotions or specialized roles. 5. Promotes patient trust and professional credibility. Certified technicians help build confidence in pharmacy services through demonstrated knowledge and quality practices.